All right, we are just a couple minutes after 5, so I think we'll get started. If anyone else is joining us, I'm sure they will join in whenever is appropriate. So I will just get started here. All right, good evening, everyone. My name is Winnica Beltrano, and I just want to thank you all again for tuning into our webinar this evening. Um, my role at Project Pulse Winnipeg, which is the organization that's hosting this tonight, is founder and principal advisor. And Project Pulse Winnipeg is a youth-led, not-for-profit organization whose goal is to familiarize high school and university students with the health sciences field through an annual conference. Although we were not able to host an in-person event last spring, we are thankful for the opportunity to move our programming online to continue fulfilling our mission. Today, our diverse audience consists of students representing 5 universities and 20 high schools across the province. I'm also joined today by some of the members of our executive team who will introduce themselves and our distinguished guests this evening.
Hi everyone, it's so lovely to have so many high school and post-secondary students from across the province to join us for this virtual event here today. My name is Katrina Langsbath and I am president of the Project Pulse Winnipeg executive team this year. Quite notably, the organization is navigating an online platform in these pandemic times in order to bring you events, resources, and opportunities for health sciences education. All the executive team roles are filled with eager and hardworking students from diverse cultural and academic communities in Winnipeg. All roles contribute significantly to Project Pulse Winnipeg in unique ways. This evening, we are happy to feature our professional relations directors who have helped to coordinate the bulk of tonight's Q&A. They will introduce themselves and today's honored guest.
Hi everyone, my name is Ria Gupta and I am one of the professional relations directors for this year's Project Pulse Winnipeg team. I am so pleased to introduce our distinguished guest today, Dr. Brent Roussin. Dr. Brent Russon was born and raised here in Winnipeg, graduating from Maples Collegiate. He then pursued further education at the University of Manitoba, receiving a medical degree in 2000, a law degree in 2009, and a master's degree in public health in 2011. Being a specialist in both public health and preventive medicine, Dr. Roussin has previously worked with the Federal First Nations and Inuit Health Branch. He also connected with Northern community leaders as medical officer of health for Northern Manitoba before taking up his current position as Manitoba's chief public health officer in June of 2019. Dr. Roussin has been praised for providing up-to-date information about the spread of the virus, his calm demeanor and straightforward answers, and his care for how COVID-19 impacts Manitoba and its Indigenous population. Dr. Roussin, thank you so much for taking the time to be here with us today. I'd now like to give Dr. Roussin the opportunity to make some introductory remarks.
Thanks for that intro, and thanks so much for having me here. This is a great organization. I wish I had something like this to lean on back in my early days. So congrats on putting on such a nice event and a great organization. So welcome everyone tonight, and it sounds like most people on this call are interested in careers in the health sciences, and so there's nothing like a 100-year pandemic to bring out the best in us and some interest in the healthcare field. So it's really challenging times right now, both in health sciences education and in all education, as well as in the practice of medicine. And we're really going through things that probably hasn't been seen in a generation or many generations. And so it's going to really reshape the health sciences and our practices moving forward. So it's very challenging but very interesting times. And so I look back at my training and feel quite privileged to be a physician. I think the ability to learn under great mentors, and then to be working, especially as a physician or other healthcare providers, is such a privileged career for many facets. So I encourage everyone to continue your hard work forward. But I'd also remind people to remember that the path is a long one. especially if you're looking at being a physician or a specialist physician. It's quite a long path, so enjoy that journey. Make sure you take time set out to enjoy your journey and enjoy your time as you learn and other things in your life. I look back to my training, and I just recently had a chance to speak to the new clerks going into their third year of medical school, and said much of the same thing. I look back to my journey, and it was through high school, was to get through high school and get into university. Then I was focused on getting my degree and getting into med school. And then in med school, it was to get through clerkship and get a residency. And then through residency, it was the end of each rotation I was looking forward. And I think I didn't spend too much time enjoying the journey. I was always focused on the end. And so when I look back, I think there was a lot of opportunities for me to enjoy that journey, because it sure was a long one and never ending if you're going into health sciences. And so great, it's really happy to be here today. And I think there's opportunities for questions, and I look forward to that. So thanks again.
Thank you, Dr. Roussin. I will now hand it over to Miguel to explain the format for the Q&A today.
Good afternoon, everyone. My name is Miguel San Pedro, and I'm the other Professional Relations Director for this year's Project Pulse team. We will now be moving on to the question and answer portion of the event. We have some pre-selected questions for members of the audience, and for those of you who we've contacted earlier this afternoon, we will be giving you the opportunity to turn on your microphone and camera and direct your question to Dr. Roussin. We kindly ask that you introduce yourself with your first name and school you attend, and to please stay clear and concise and to not deviate from your question. Additionally, at this time, we will not be allowing follow-up questions. With that said, I will now hand it off to Katrina, who will be moderating the Q&A.
Thank you so much, Ria, Miguel, Winnicott, and Dr. Roussin. Our very first question comes from Ganeet.
Hi, everyone. Can you hear me? Okay, I don't think there's an option to turn on my video or anything currently, but I can just go ahead with my questions. So hi, everyone. Hi, Dr. Roussin. My name is Ganeet, and I'm a second-year student in the Faculty of Science at the University of Manitoba. My question goes like this. Did you consider any other careers throughout high school or university, and what made you decide on medicine/law and eventually something in public health?
Yeah, great. So thanks for that question. And I think, quite early on, I was, always had the thought of being a physician or perhaps a lawyer. I remember back, I think probably in grade 10 is where I really decided that I wanted to be a physician. When we started picking our courses for the next year, I was heavily science loaded. And I don't think I ever really looked back from there. Like I say, I think in a way, I became, too focused on one path. Didn't really, at least take time to enjoy. I was always goal driven only. But I was always fascinated with the law, and continually came back to times of thinking about going to law school. I know that in my first years of practice, I, continually was deciding on whether I wanted to write the LSAT or not and go back. And finally, I pulled the trigger on that. So I was mostly focused on healthcare and medicine. Certainly a lot of back and forth on what specialty during medical school. And you can, see, I think that's another piece that, we don't have to stick with our original focus. I think early on I was decided to be a, family physician or potentially a pediatrician. But as I got into practice, got more driven towards public health and the legal aspects of medicine. So things change over time. I know a lot of my colleagues have had career changes. So don't be afraid over time if things don't work out exactly on the path you choose.
Thank you. Our next question comes from Kiana.
Hi, Kiana, are you there? Hi, Kiana, I think your mic might be muted, so you might want to double check. Sure. Yeah, for sure. If your mic's not working right now, all good. You're free to type your question, and we can say it out loud for you as well. All right. So Kiana's question is, what is a typical workday like for you, Dr. Russin?
Mm-hmm. Well, right, yeah. So the work days especially with the during the pandemic, have been long days. We're back into incident command. So typically they involve early in the morning to review the epidemiology for the day, the new cases, any other the factors, and then I brief the Minister of Health first thing in the morning. Following that, we meet with our incident command, and so Lynette and I are the incident commanders. So we'll have a brief meeting to review the agenda for our incident command meeting first thing, and then go through there with the section chiefs to review. So incident command is made up of 4 areas: finance, logistics, operation, and planning, and each of those have a operations chief. And so we'll run through the process, what should be occurring during that day. And then, many days I'm preparing for media and then other meetings. And then we finish the day up with a meeting with the clerk of the executive council, who is the deputy minister to the premier. And that meeting takes place after this. So usually about 6 o'clock we start that meeting, roll up the day, and discuss what's coming next. So very tedious days. And during the first wave, that was actually 7 days a week with no change. I forgot what day of the week it was most time because all the days look the same. But right now we're mostly at 5 days a week.
Awesome, thank you, and thank you for your question, Kiana.
Our next question comes from a student who's actually homeschooled and who has chosen to remain anonymous, so I will be reading their question for them. What are you enjoying most about your job right now?
So I think, what I would say with this is that, to be in my role during a 100-year pandemic, it's obviously it won't happen very often. And so although it's taken a huge toll on me personally and my family, it's still quite the privilege to be in this role during this time. And so I think that, I'm not sure if I would, describe it as enjoyment, but certainly it's a privilege to be here. And when you've, worked to be in a position like this for as long as I have, it's to be able to help lead Manitoba through a challenging situation like this is again something that, while it's very challenging, very pressing, I do take time to just review how far we've come.
Thank you for sharing those insights. The next question we have is also from a student who is asked to remain anonymous, and they're from Vincent Massey Collegiate.
Oh, actually, Katrina, I think they're here today, so
oh,
I might be able to. Yep, I will allow them to ask a question.
My bad.
No worries. All right. Hopefully they're active on their computer. This question is from Shivane from Vincent.
My question? Okay. Sorry, it cut out for a second. The question I submitted was, which institutions specifically are most COVID cases coming from? Like schools, bars, stores, and stuff like that?
Yeah, thanks. So real good question, because this is a big thing we look at with our epidemiology, right? We want to take that targeted approach, that risk-based approach. So unfortunately, right now, what we're seeing is widespread community-based transmission. So we don't really have places like that where single areas are affected. What we saw very early on in the second wave was the cohort age 20 to 29 were the predominant cases. Many of those were linked to restaurants, bars, parties, and things like this. But since the last many weeks, we haven't been able to specify where, because we're looking at wide-based community transmission. We look at about over half of our cases we're not able to link to where they acquired it. So it's just that true community-based transmission. So we've lost the ability for a targeted approach, and that's why we have these widespread restrictions right now.
Thank you for sharing those insights.
Yeah,
Our next question comes from a student who has asked to remain anonymous, and they're from St. Paul's High School. Their question is, if hospitals reach full capacity, will schools remain open?
Yeah, and so these are those type of balances, these type of indicators. What we see is that we haven't seen a lot of transmission within schools. Of course, you see the reports because we try to keep Manitobans informed. There's lots of cases in schools. Those are all acquired in the community. Once we find a case in a school, we've seen actually very little transmission within that cohort. And so the closure of schools hasn't occurred yet for that various reason, is that we're not seeing a lot of transmission. And then, of course, the importance of school. Right, and so in a time like a pandemic, where we know we can't do everything we want to be, we can't be back at normal. We do have to make choices on what do we want to happen. And I think most Manitobans feel that the importance of school is one of those things. And so if we start seeing worsening indicators, especially something like our healthcare system being overrun, then we do have to take more drastic measures than that. We do have a plan for schools, but we're going to do whatever we can to keep people in school, especially the younger groups. But it really depends on what we see. If we see our hospitals being overrun, we'll have to take extraordinary measures.
Our next question comes from Harshnor. Hello, Harshnor, are you there?
Just gonna try one more time here. I think they may have left the webinar, unfortunately, once I invited them. So we can go ahead and just ask Harsher's question on their behalf.
Sure. So the question was, BC has a swish, gargle, and spit test for school students. So is Manitoba considering that, as we are only doing nasal pharyngeal swabs?
Yeah. So that's our test in Manitoba is predominantly nasopharyngeal swabs. BC does have this swish and gargle test. We're still looking at the validity of that test, what we would call the sensitivity or specificity of that is, and how we could implement it here. You've seen other reports of various other tests. Although some are approved, when we actually look at the validity, how good they are, there is some lacking in there, but we're constantly trying to expand our testing regime to rapid testing, to test other than just the NP swab. So we don't have anything immediately in the works with that swish test, but we are looking at that plus other different platforms as well.
Thank you. Our next question comes from Princess.
Okay, hi, am I unmuted? Yes, great. All right, good evening. I'm Princess from Steinbach Regional Secondary School, and I just wanted to ask, what resources are you providing for anyone whose mental health is being affected by the pandemic?
Yeah, so this is really, really important with, just the pandemic alone. It's, a lot of people are fearful. Add on top of that the restrictions we have in place, which has put added anxiety on people. And so just we know that there's these, other effects on health other than just COVID. And so we contemplate these when we're putting restrictions in. We know we have to deal with COVID, but we know there are a lot of unintended consequences when we put restrictions on, and mental health is certainly one of them. So there's a few approaches to this. One is that we've continued trying to get the message out to people that, attending for healthcare is safe. So if you need to see your physician or healthcare provider, if you need to go to a hospital, it's safe to do so. There's lots of policies in place that protect our patients. So if you need to see a healthcare provider, don't hesitate to do that. Healthcare providers now, physicians are able to have virtual visits easier with their clients, and so this can assist with access as well. And then the government has provided coverage for counseling sessions, as well as some cognitive behavioral therapy sessions. So anyone who's interested can go to manitoba.ca/COVID and can look up mental health resources, and you'll see some free sessions that are available, and really there to help support people through this, because we realize this are real challenging times.
Our next question comes from Maya.
Hello, my name is Maya and I'm from St. John's Ravenscourt. So Dr. Russin, Manitoban data seems to show that roughly 10% of residents in a personal care home will die if the home is infected with COVID-19. My grandmother lives in one of these homes. What additional resources aside from PPE are being provided to personal care homes to protect this vulnerable population?
Yeah, and so we knew very early on in this pandemic that age is a severe risk factor for bad outcomes, and that once that virus got into personal care homes, we have a very high risk population. And so our first steps were to do whatever we could to keep that virus out of these homes. Again, it's a balance. Because we received a lot of criticism regarding having the visitor restrictions. We have restrictions on the amount of PCHs that an employee can work at to limit the contacts. And again, that's created some challenges to staffing. And so largely at the provincial level, it is the policies that we have in place. So, the best way to protect everyone in the population, including those at the highest risk, is to limit the community-based transmission. It's very difficult to just protect single populations, because we know that people who work in personal care homes are in those 20 to 29 age group and other age groups. So the best thing to do is to try to limit the community-based transmission, and that's where we've put on those restrictions and reviewing more. As far as staffing goes, we've worked with the region on that. We've worked now with Canadian Red Cross to try to increase the ability to staff these places, because one of the challenges in healthcare is that as we see more and more cases, we get more and more healthcare workers that need to be self-isolating either their cases or contact cases. So it puts a lot of strain on it. So yeah, like many people, I have a loved one in a personal care home right now. I have a family member that works in a personal care home. So it's very challenging times, but we have to do whatever we can to keep the virus out. And then ensure that the staffing is appropriate in these areas, especially that we're losing a lot of staff, at least temporarily, because they need to self-isolate either because of their cases or contacts. So we work with the regions. The regions largely do this, and then we have our standards branch that works from the province to ensure our the standards are being met. So a lot of work, a lot of different agencies working on that, but very high risk population that we need to ensure moving forward we do a better job of protecting.
Our next question comes from Brian.
All right, hello everyone. My name is Brian. I'm a first-year engineering student at the University of Manitoba. As we know, we are at an extremely critical point in our fight against COVID-19. I'm just wondering why, with the increasing strain on the healthcare system, why are gyms and dance studios still allowed to be open?
No, I think it's a good question, and the answer to all of these ones is the balance. Right, we've heard about the effect of mental health and what can be done about that, closing all these things do have that added effect where on mental health, even physical health. So it is that balance, and we receive a petition from those sectors to make them essential, to not even restrict them any further. And so we hear from both sides. And so the answer can always be we just look at where that balance is. So we haven't seen a lot of transmission in the gyms or the dance studios, but what we do know is this is transmitted with prolonged indoor contact. And so right now we have those open, albeit with quite limited restrictions on capacity level, but we are even at this meeting that I'm going to after this, looking at what further restrictions do we need to implement to further drive down those numbers, knowing that each restriction we add has that unintended consequence of on health. So these are tough decisions that will have lasting impacts on both sides. So it's a real good question. And the answer is we're absolutely looking at that, and we're going to hear back on that relatively soon.
Thank you. Our next question comes from another student who was asked to remain anonymous, and they're a student at the University of Winnipeg. Their question is, why are active cluster locations and demographic information not being released to the public? Do you think Manitobans would make better decisions if they had access to this information?
So we release quite a bit of information, especially if we see a case that could have public exposure. We certainly announce that and the timing of that. We do announce a lot of the demographics, and we do it by health region and setting there. So we break down the cases quite a bit. I think the messaging is that this virus spreads with close, prolonged contact with symptomatic people for the most part. We need to avoid closed indoor places and prolonged contact. And we've been messaging that for quite some time. And there really isn't the opportunity to make those decisions. The decision is we always have to practice the fundamentals. I know that early on we heard from many Manitobans saying they want to know precisely where the cases are, what part of a city or what part of a town. And really, as far as public health advice goes, that really shouldn't matter. As we say, if you live in a part of a city that has a large amount of cases, you should wash your hands frequently. You should practice physical distancing. You should wear a mask indoors. If you don't live in a part of a town that has many cases, you should wash your hands frequently, practice physical distancing, wear a mask indoors. It really shouldn't change your behavior. So because there's no cases there now yet, If we let up, there sure could be cases there and cases there in a hurry. So really all Manitobans, no matter where they are, we want to practice those fundamentals. We want to be transparent and let people know where those cases are, but it really shouldn't drive a behavior change. The behavior change should be all and no matter where we are.
Our next question comes from Matthew.
Hi there, can you hear me?
Yes.
Perfect. So my name is Matthew. I'm a third-year student at the Faculty of Engineering at the U of M. And my question is, why are 14-day isolations from interprovincial travel not in place? Should all Manitobans have to pay the price for some individual ski trips in BC? And if a travel ban wouldn't be reinstated as before, would you consider interprovincial collaboration to see if a Saskatchewan, Manitoba, Northern Ontario closed bubble could work?
Yeah. And so early on, when we were dealing with this first wave, a lot of unknowns, we did have those, not restrictions, but just a 14-day isolation of the interprovincial travel. When we looked back and did our analysis, we had very minimal uptake of that actually, because it is something that's very difficult to enforce. There's no way we would be able to know everyone driving into our province and where they are and have ability to watch them. So the adherence to that was quite low. In our second wave, we see a very, very minimal proportion of our cases are related to travel. Most of them are related to community-based transmission here. And so going forward, nothing's ever off the table. But this is one, if we look at, say, Manitoba right now, and we do what's called the circuit breaker, where we put the very stringent restrictions on for a relatively short period of time, whether that's one incubation period or two, get those numbers down, and then try to loosen things up again. We could maybe have a big impact in a relatively short period of time. With travel restrictions, when can we ever release them? Right? If we put travel restrictions on, we can't put them on for 2 weeks or 4 weeks and then release them. That wouldn't have the effect. We would just be right back in the same risk level with the travel restrictions. So anything we do related to travel, we have to be prepared to have those on for 6 months, a year. And when we had those 14-day self-isolation in place, and we still have it for the East, we hear all about the difficulties it has on business, the difficulties it has with family unification. And so again, it's these unintended consequences of things that we're doing. But just with that travel one, to put it on, it's when could we lift it? And having those on for 6 months to another year could have some very significant negative consequences on Manitoba and Manitobans.
Thank you. Our next question comes from Levi.
All right, hi everyone. My name is Levi and I am a third-year student at Canadian Mennonite University. So my question is this. Is there any worry that the fatality rate of COVID-19 in areas of prolonged high transmission will increase through microevolution because the virus will rely less on the ability of the host to survive? Or is the incubation period for COVID-19 long enough that this would be highly unlikely?
Yeah, so it's a good question. With these RNA viruses, they do have a tendency to mutate over time and change in many different ways. We haven't seen that with SARS-CoV-2. We haven't seen much change over time. Certainly not. It certainly mutates, but we haven't seen a change in its virulence or any other type of factors like this. So we always are concerned with RNA viruses that it can shift. Probably the biggest concern is if we see an antigenic shift where we're trying to build a vaccine against it, and if this shifts antigenically, leaving our vaccine less viable, that would be probably the biggest concern. That's exactly what we see with influenza every year. Influenza is another RNA virus, but it has 8 segments, so it has even more ability to mutate, to shift and drift. And so, I think it's valid. We have to continue to watch this virus. I think our approach to it is just to decrease the amount of transmission going on. Not taking in consideration the possible effects that has on virulence or transmissibility through evolution. We're just at a place where we have to do what we can to decrease transmission.
Our next question is from Madhumita. All right, so it looks like she wasn't able to turn on her mic, but she left a comment in the chat that I can read out loud. She said, "Hi everyone, my name is Madhumita, and I was lucky to be on the Project Pulse executive team for the previous 2 years. I am a grade 11 student at Fort Richmond Collegiate, and my question was, if and when do we get a COVID-19 vaccine? What will our lives look like?" So that was her question.
Yeah, and so this is what we're shooting for, and you may have heard today that some preliminary data on the Pfizer vaccine was very optimistic, showing about 90% effectiveness, which would be very good. Their target to have a vaccine approved would be 50% effectiveness. So these are very reassuring but early numbers. And so with the vaccine, it's not going to change things immediately. It's very likely we could see a vaccine in the new year, but it will not be in great quantities. It'll be in numbers that are quite small and not anywhere near the ability to give us herd immunity, but can give us the ability to protect some of the most vulnerable people. So those in the older age groups and things. So that could have an effect on our case fatality rates early on. But it's going to be still likely a year away before we have significant levels of vaccine. And if you think about the vaccine coverage we need, if you heard of R0 or the basic reproductive number, where in a totally susceptible population, the average amount of people that a case spreads this to is what we call R0, and so that is about 2.5, we think, for COVID-19, and the vaccine coverage rate that we shoot for is calculated by 1 minus the inverse of R0, and so for that would be about 60% of the population. And so if we think about herd immunity through natural protection, that would mean 600 cases a day for 3 years for Manitoba to get to that level. So you can see we're not going to get to herd immunity through natural immunity. We're going to need a vaccine. And so very promising levels. Like we say, we're not going to be in this forever, but until we have sufficient access to quantities of vaccine, we're not going to be back to normal.
Our next question comes from Ria.
Hi again, Dr. Russin. So the repercussions of remote learning on high school students will be quite profound, as not having face-to-face interactions and undergoing a less rigorous level of work may put them at a disadvantage in university. What do you plan to do about this, considering that Manitoba already has the lowest standard of education in the country, and it may be bound to get worse?
Mm-hmm. So I think that very early on when we started our restart plan, we knew it was important to do whatever we could to get people back in school. We knew it's important. So as far as plans or even about the standards, that's not necessarily for me. The Department of Education can answer those. But I would say is that we've done and we're doing whatever we can to keep students in school, because we know how important that is. We could face something in the near future where we have to, again, in the short term, reduce the risk even further, allow for more distancing in schools for the younger children. So it certainly is possible we could look at remote learning for the higher grades, but again, the idea would be for the short term, and given the amount of time that's been there to prepare, hopefully something that can offset the in-person learning, at least for the short period of time. So we just all know how important it is. It's possible this pandemic, this virus puts us in a position where we don't have much choice, at least for short term, but hopefully it'll only be that a short period of time.
The next question is from Miguel.
So this next question is from a student at the University of Manitoba. And the question is, there was a recent announcement by Premier Pallister that the government has invested $2.1 million into enforcement. Do you think that the money could have been more useful when put into healthcare?
Mm-hmm. Yeah, so I mean, this is a good question. This is what we talk about opportunity costs, right? So if anyone who's spent some time in economics know opportunity costs, essentially the same dollar can't be spent twice. So every dollar we spend on enforcement, we can't use that to spend on healthcare aids, and vice versa and things. So again, it's like everything we do, there's that balance. We know that unchecked, this virus would overrun our healthcare system. So we can't just focus on healthcare or we'd be overrun. We have to focus on measures to reduce the amount of transmission. And so those are the non-pharmaceutical interventions we call, or the public health interventions, and largely under the orders, public health orders. And so for those to be effective, there has to be some level of enforcement. And what we've seen in the orange levels in Winnipeg is we just haven't seen the buy-in from Manitobans. We just haven't seen a change in behavior. We've seen the same amount of activity. We see that the cases have the same amount of contacts that they did early on. And so we're left with, changing our approach, and enforcement is one of those things. And so we can't just put all our eggs in healthcare, because even if we did, we'd be overrun. We have to find ways to limit the transmission of the virus.
Thank you for your response. The next question I'll be asking is from a student at the University of Manitoba who was asked to remain anonymous. And they say, reports in the media have suggested that our healthcare system is reaching capacity due to the influx of COVID-19 cases, and Manitoba doctors are voicing their fears. Yet despite the deteriorating situation, health officials have downplayed the situation and tried to reassure Manitobans that our healthcare system still has sufficient capacity. With two contrasting pictures, what is the true state of our hospitals and the healthcare system?
Yeah, and so this is these are all real things. I think that there is a number of healthcare workers who have voiced their concern, their immediate concern for the healthcare system. I mean, it certainly is, given the amount of people working and the amount of people that we interact with, it's still only certain people's view. But I think we all agree that the trend we're on, if it continues, we will overrun our healthcare system. And so for that, we definitely agree. The government and public health, we have put in restrictions and have escalated over time. We are, as we speak, looking at more restrictions because we just have to, really change the transmission dynamics right now before we see this. I think some of the contention is that the healthcare system does have a very good plan to significantly expand capacity as needed. That comes at a cost. Of delaying non-essential healthcare like elective surgeries and other such things. But we do have the ability to still rapidly expand to meet the demands. But even that would be reached relatively quickly if we don't change the dynamics of the virus. So I think we're all on the same page that we need to act, and we'll continue to act moving forward.
All right, so we've approached our final question, and this comes from Sanjana.
Hi, I'm Sanjana, and I'm currently a second-year student at the University of Manitoba. I would like to thank you for all your hard work these past months. My question for you is, what can our age group do to get involved with the fight against COVID-19, especially since we see the virus affecting all age groups?
Yeah, and thanks for that. I think that there's a number of things. We are looking for volunteers and for things like contact tracing and other measures. So going to our website, if you're interested in helping out that way, there's certainly going to be opportunities with it. I think a big thing from any Manitoban is to do what they can to to practice the public health approach to this, to voice the importance of it to others, to stay kind. These are challenging times, and we see people getting very frustrated with the store owners that are just trying to maintain physical distancing or masks. We have healthcare workers that are quite scared right now. So it's really challenging time. So I think the more everyone can continue to inform themselves, to be kind to each other, to try to to practice those fundamentals, I think is going to be paramount. Knowing that it's going to be a relatively short period of time. I know that everyone wants this to be over and back to normal, and it will be, but it's not going to be that this calendar year. And it's not going to be that in the early next calendar year, and it might be longer than that. So we just have to do what we can to keep this transmission down. We'll be able to do some of the things we love. We're going to be not able to do other things for now. But I think it's just it's great to want to be involved, and I think there's going to be a lot of opportunities to directly be involved, such as volunteering, and then certainly just indirectly to be involved as Manitobans, trying to work together to get through this situation.
Wonderful. Awesome. All good. Wonderful. Thank you for your response, Dr. Russin. So we're just quickly looking at the time, and with these last 5 or so minutes that we have, we were wondering if anyone from the audience has any last minute questions for Dr. Russin before we wrap up. Now would be the time if you want to drop something in the chat, and we can open your mic just to see if we can fill these last 5 or so minutes. So we see that Shivane has a question, so we'll allow Shivane's mic to be open now.
Hey guys, can you all hear me? Okay. I guess my question is, in Ontario, my understanding is that they've stopped contact tracing because they've recognized that it perhaps isn't very effective or as effective in terms of the cost and the benefit. So is that something that you see Manitoba doing at one point, is stopping the allocation of fund resources, time and energy to contact tracing and investing that in something that might be a little bit more productive?
Yeah, and so right now, no. Right now, in Ontario, they've had to stop some of it because they were overrun with cases. And so if you can't do contact tracing properly, then yes, it has limited effect. But the public health interventions of case identification and isolation, contact identification and isolation are paramount to our success here. And so we have no plans in stopping that. We've been ramping up our ability to do so because once you start falling behind on that, then you are in a position where you just have to cut loose on certain cases. But we don't want to get to that point. We want to be able to do that contact tracing, get those contacts isolated, and decrease the amount of contacts per case. So we're doing whatever we can to be able to avoid that situation.
Awesome. Thank you, Shivane, for your question. I have another question in the chat here. Sheena is asking, with everything going on, the current circumstances, what do you think might happen for Christmas this year?
Yeah, so Christmas is definitely going to be different. It's not going to be a normal Christmas. What we'd like to see is a dramatic decline in the transmission right now. So when the holiday season comes up, we're not seeing rampant community-based transmission where we can have some sort of ability to celebrate the holidays, not normally, but some sort of ability with that. But we would, sort of tell everyone now it's not going to be normal, and I think that we're going to be in a position where we're going to have to provide some essentially, harm mitigation techniques to people because, realistically, we understand people are just not going to forego the holiday season. And so we're going to have to provide some real specific advice on not risk-free, but sort of risk-reduced ways of doing it.
Awesome. All right. So we have another one from the chat here from Wudra Dave. Dr. Russin, any updates on current research being done with COVID-19 patients in Manitoba? Some retail stores have shut down for a day because they have had an exposure. However, that has not been made public. Are there particular guidelines that retail stores must follow?
Yeah, we do have some guidelines for for pretty much every sector, and they're online. As far as closing, we only advise closing at if public health advises. So there's been a number of occasions where retail outlets have closed. We've seen daycares closed. And when public health investigated, the person wasn't even infectious at the time they were at that location, but they decided to close. And I mean, that's okay. Everyone wants to do their part. But we usually suggest that wait for public health to investigate, and we'll provide you that advice. But yeah, we have a lot of advice to sectors online.
Awesome. Okay, I think we're going to take our last question of the evening. And this question asks, this afternoon, there was an anti-mask rally at Polo Park. How can we make sure that we can lessen the spread of the virus when we have individuals rallying to not listen to the rules and will therefore possibly affect those of us who are at an increased risk?
Yeah, and I think this is a challenge. We've seen over time in that first wave, I think people around the world and, in Manitoba, they're very scared of the unknown, and people stepped up and followed public health advice to the T. And we could see that our first wave is essentially non-existent when you compare it to what we're seeing now. But over time, people are tired of the restrictions. I don't blame them, but it just doesn't matter how tired you are with them, or it doesn't matter how many things you enjoy that can't be done now. The virus doesn't care. The virus is going to be here with us. So no matter, how much you want things to be back to normal, they're not right now. And so we have to try to unite. During crises, it's very easy to divide, and people often try to find ways to divide people. We need to find ways to get everyone on board. And it's one of the reasons why we have to be careful with the length and the strictness of our restrictions, because we don't want to lose the people. We want people to still be on board with this, but it is a challenging time.
All right, and so that was our last question. So we're just wrapping up the hour now. Again, we want to thank Dr. Brent Russin for all of his time this evening. We surely learned a lot from your responses, and I hope that the audience did as well. So just some final thoughts here. If anyone is interested in learning more about Project Pulse Winnipeg and what we do, you are welcome to check out our social media and our website, projectpulsewinnipeg.ca. And before we close up, Dr. Russin, do you have any final remarks?
Yeah, just thanks again for the opportunity, and all the best to everyone, best in your careers, and best in health right now. And look forward to maybe meeting you all when you're doing rounds.
Sounds good. All right, we're wishing everyone a great evening. Please take care and stay safe, and we'll all see you again soon at our next event. All right, have a great evening, everyone. Bye.
Bye.